I'm the Chief Medical Officer at Rythmia Life Advancement Center in Costa Rica. I have a doctorate in psychology, background in mental health, and I've been working in healthcare for about 32 years. So I have a lot of experience working with people that have addiction, trauma, and anxiety, depression, and I've worked with acute psychiatric patients as well when I was in Los Angeles doing my postdoc hours and pre-doc. So I have a lot of experience seeing what people go through that are struggling. And one common theme for most all of us that have issues that we're dealing with is that we're unhappy, and we're dealing with lots of different reasons for this. There's scarcity issues, there's cultural issues, there's political reasons, there's neurochemical issues, there's coping skill issues, there's family dynamic, cultural, societal situations. There's a lot going on in the world. There always has been, and there always will be. And there's a lot going on right now in particular. So how do we deal with all this stuff in a way that is practical? You know, a lot of us don't have millions of dollars and thousands of dollars to spend in rehabs or mental health therapy or retreats or, different places or meds. A lot of us have bad insurance. There's a lot of challenges. There's a lot of barriers to healthcare. And, when you feel that you don't have empowerment to get better, then you get discouraged and your self-esteem plummets and you feel that you're trapped. And then that's where your mood starts to decline and you become desperate and even suicidal, and you become hopeless and you feel overwhelmed. These are common feelings that a lot of us go through, and some of us go through for years at a time, if not our whole lives. How do we break out of this sort of negative way? How do we get a foothold and move past this stuff? Well, there's a few ways to do it, and there's a few ways that I'm dealing with as the chief medical officer of this facility. And the reason I'm working here and I'm a part of this company is because I've seen these modalities that we're using really work well for people. And they're about creating self-connection and about empowerment and about being where you can make decisions for yourself and take charge of your life. And you don't need anybody else to do it for you. It's something you can do for yourself, but you have to learn how. You have to be shown the right direction to go in, and you have to feel supported in the process. So what we've built at Rythmia is exactly that system. We have a variety of modalities that are about self-empowerment and emotional security, meaning that you process historical painful emotions that are based in trauma and other things, and you get clarity and groundedness in yourself. And the modalities that we have all together with a certain protocol I'll name a few of them. We have breath work, we have meditation and yoga, we have exercise and super healthy eating, and we have plant medicine, ayahuasca, that is all medically sanctioned and medically safe. And all of these modalities work together in addition to our hydrocolonic cleanses and also our beautiful property and healthy relationships that you build with people that come as peers. All of that contributes to a sense of empowerment and fulfillment, and also sets you on the path to self-realization in a way that's guided, that makes sense for you. There's all these places and people and different things that say, follow the way I'm doing it, because follow me and do what I do. But we don't believe in that. We believe in you should follow yourself, that you should figure out what you want, and that you should achieve the things in your life that resonate with you. And everybody's different, and we all have different ways of doing that. Some people, their daily practice is something that we teach people here to have. Some people like to meditate or go for a walk. My daily practice is exercise. Sometimes it's surfing. So everybody's different. Everybody has a unique sort of goal or desire that they're working on to get themselves on the path towards happiness and success. So what I'm really saying is, we've all been in these positions of feeling overwhelmed and upset. It's part of life. We can learn from it and grow from it, or we can stay in it and be kind of beat down longer in there. But I would prefer to just learn from the situation and move past it with new tools to help you cope with life in a way that's effective. And that's what we're doing at Rythmia. We're teaching people how to do this. So if you feel that you've tried all these different things that are out in the world to try to get better, and they've, maybe stabilized you a bit or gotten you to a certain point, but you just seem to not get past that point, come here and check out what we're doing, because this is going to be the point that you can break through and turn that corner and get what you really want out of life, which I'm going to make an assumption is happiness, success in the way you want it, and feeling peace. That's what we're about. Thanks for listening. See you next Monday. Pura vida from Costa Rica. Dr. Jeff.